Hi, my name's Sarah, and my daughter recently had a gastrostomy button at the John Radcliffe Hospital in Oxford. So, from the very first appointment that we had with the surgeon, all the way through to leaving hospital, the support that we had from them was incredible. They were able to give us advice on exactly what it would look like, how it would feel by using the model. And although it was a big emotional decision and a big thing for us to do, ultimately it was the right thing for us to do, and it saved our daughter's life. So swapping the mindset to having meals at the table with a knife and fork and cutlery to then having this button is a really big thing, and it's a big journey for any parent to go on. But it has been so smooth. The community nursing team and the team in the hospital were able to show us exactly how to use it, how to feed our daughter, and with help from the dietitian, both in hospital and in the community, we were able to find exactly the right balance for our daughter in terms of feeds and some oral food as well. We had lots of sort of training as well from the Abbott nurses in how to use the pump, how to set it up, what would happen if it started beeping at us, and what possibly could go wrong, so that we already knew that once we went home, we could do it, we could get on with it, and we could start feeding our daughter in a completely new way, but in a way that was the best thing for us and our family. So, top tips. Firstly, ask as many questions as you can whilst you're in the hospital. But once you're out of the hospital, don't be afraid to get in contact with the community nursing team and say, is this normal? How do I do this? I can't quite remember. I remember I made so many notes when we were in the hospital about how to do things, which way to turn the dial, how to switch it off, how to switch it on, how to change the colour and the brightness of the screen. And I got home and I looked at this pump and thought, oh, can I do it? But trust in your instincts, and if there's something that you find tricky, then there are lots of people out there that are willing to help. Another really top tip was there's an amazing Facebook group site for tube feeding your child, and I joined that really early on, and on there are other parents living and breathing exactly what you are going through at that moment. People that are about to get their operation, people that have had children on tubes since they were born, and using them as a support network is fantastic, and that has really helped us too. My other top tip is we were given some Tubey Pads whilst we were in the hospital, and they have been fantastic. They really help to keep the gastrostomy button in place and to stop that sort of overgranulation as well. We've got them in all different colours. We even had a lovely friend who made us some Christmas ones so that my daughter felt that she could dress up for Christmas and even dress up her gastrostomy button as well. So in order to prepare my daughter for surgery, we started going down the story route, and we decided to call it our fairy door because she's really into fairies. And the hospital staff said that it was a really nice way of introducing the idea of having this magic door going into her tummy where milk could go, but we couldn't put chocolate fingers in it, could we? And we could put water into it, but we couldn't put crisps into it. So it helped her to understand what foods were going to go in through her door, and also for which foods were going to be eaten orally. So I think really that's my top tips of try and create a story for your child when you're about to go through this journey. Ask as many questions as you can at the hospital, and try not to panic, because although this might feel like a really big thing, this is the start of something new. This is the start of a new adventure and a different way of living for your family. And that's not a bad thing sometimes. Change can be a bit scary, but ultimately you're doing the best thing for your child by doing this. We certainly believe that. We wouldn't have our happy girl if we hadn't gone down this route. It was the best thing we ever did, and I am so grateful to the Oxford John Radcliffe Hospital staff because they are incredible. Thank you.